Well, welcome, and I have a question. Is anybody here for the first time ever to hear Dr. Collins? 1, 2, 3, 4 newbies. That's good. I don't know how many lectures I've heard him give, but every one has been wonderful, and I've gained knowledge every time I hear it again. So those that are new here, the restrooms, if you haven't seen them, they're on the right, headed down the hall. And Dr. Collins will have a little halftime break, and we'll give you some more information during the halftime break. Time to move around a little bit and ask questions. And at the end, you'll have a question and answer period, will you? Okay.
Yes.
And we'll have a mic. So if you have questions, be sure and save those till the end, but he will help you with those. And that's usually my favorite part of the lecture, the different questions and testimonies that come out of what we're learning or have learned. Before we begin, let's bow our heads for prayer, shall we? Heavenly Father, we just want to thank you today that you've given us life. You've given us an abundant life. And Father, we've come today to learn how to better care for the bodies that you have loaned to us. And I just pray that you will bless each and every person here. We're all on our own journey, our own separate journeys, yet, Lord, we know that the principles that are going to be shared today can aid each and every one of us personally. And so help us to make that application in our own lives, that we might live the more abundant life that you have planned for us. In Jesus' name we pray. Amen.
Good afternoon. I have a question for the gentleman here. Why do we have almost all ladies here this afternoon? I'm talking about diabetes. More men are diabetic than ladies, but look who wants to take care of themselves, so let's get with it. Maybe that's why you guys live longer than we do. I'm not sure, but there's got to be some correlation going on here. Anyway, I'm glad you're here, each of you, and we'll spend at least an hour, and then we'll open up for questions and take a break, and then we'll spend more time. What I'm trying to pick is those things that are not just nuances of information, but I'm trying to demonstrate when you want to be free of being diabetic, that's what we're going to talk about. So we're going to pick the essence of what it's going to take. The title for if you want a title, I said, A Disease of Choice, Diabetes. Now some of you are going to probably get upset at that because you go, wait a minute, I'm diabetic and I don't have a choice. And I'm saying, well, I happen to believe you do, otherwise I might as well just close off and see you all later. Because most people, except for probably 10% of diabetics, can be either free of their medication or definitely reduce it. They can control their lifestyle well enough so that they have minimal to no side effects from being diabetic. Now, what's happening in America, we're going to take a look at, because this is the most devastating disease that's happened to not just America, but to the world right now. I know that coronavirus is bad and difficult, but it pales in significance to what we're going to spend our time on this afternoon. About 400 years before Christ, BC, the father of medicine, let food be your medicine and let medicine be your food. He also stated medicine should do no harm. The second part of that is actually more difficult than the first part of it. Because right now, I can't name one single medication that qualifies for this situation, all the way down to aspirin. So what do? All the time, the doctor's trying to figure out risk versus benefit, risk versus benefit. And the drugs a person takes, are they taking more risk? In other words, is the drug worse than the disease? Or if we just let the disease run its course, it's not as bad as the drug. So that's what we're really debating right now. It's not debating that they don't do any harm. It's a matter of debating, is the harm worth it? And that's kind of hard. 2010 statistics, I'm going to contrast that with the latest report that I have, which is 2020. But in reality, it's 2018 because we don't have the data out. About 25 million Americans are diabetics. about 8.3% of our population. The diagnosed plus the undiagnosed gives you that number, about 18, almost 19, and 7 million. But it's the next category that should be totally scaring us completely. And I really wish doctors wouldn't do this because, see, I don't believe in pre-diabetics. I believe you are diabetic or you're not. Or to say it differently, you're walking down a road that if you stay on that road, you would know what the outcome is. So when you tell a person they're borderline, what goes through their mind as a patient? Whew, boy, I made it past that. Man, I just made it. I snuck under the line, and I'm good for a year. They told me I'm good, and they don't want to see me for a whole year. No, folks, stop competing with your medical doctor, okay? Because, see, I don't like the report after I do a treadmill on someone and I tell them their heart is fine, and then I get a call from their wife 2 weeks later and said, just want to let you know my husband dropped dead of a heart attack. Well, that makes me feel like the biggest goon on the block for a long time. But then I also know the limitations of all medical testing. So we've got 79 million people who are on a pathway of having blood sugars that are abnormal, and it's a matter of how long their pancreas is going to last. That's really what that means. And when you start looking at 79 million people plus 25 million people, we have about 1 in 3 Americans that are on this pathway. This is worse than cancer. This is worse than heart disease. This is worse than a flu virus. And by the way, I see the news, or you hear the news, but what they don't tell you is what is the news about how many people you do expect to be dying of pneumonia or a viral infection in the United States, everything. What you will find is even though we hear a lot about the news, it actually pales in insignificance. The coronavirus so far is spreading, but if they would tell you what the H1N1 virus had spread in the world in the same period of time, you'd be shocked. So it's actually very much overstated at this point. By the way, I'm not flying to China in case you're worried about me, okay? 1.9 million new cases in 2010. The good news about this whole slide is that that was a high point. We're actually having a few less new cases being diagnosed at this point than we did in 2010. 2020, the report, once again, this is 2018 data that came out. We went from 25 million, now we're sitting at 34.2 million people, and 10.5% of our population, not 8% anymore. We have 88 million, not 79 million, who are now on the pathway of what we're calling pre-diabetic. That is CDC, Center for Disease Control, stats. Here's the scary point. 1/3 of children born after 2002. So how old would they be now? 18 years old or younger. 1/3 of the children born after that date are going to be type 2 diabetics. Folks, they're not here. I don't see too many people under 18. The point is that we're doing something radically wrong in our family structure, in our school structure, in our eating patterns, and something is coming home to roost, so to speak. We expect them to die 20 years prematurely. If you follow lifespan, and lifespan can be kind of a skewed result because we've gotten really good at saving preemies, and I'm thankful, but when you save one preemie, you get the whole lifespan when it comes to statistics. So we've gotten really good at saving preemies, and so it makes our longevity look better. But since 2016, 2017, then 2017, 2018 year, life expectancy is going down. If it continues for 3 years in a row, we will probably consider that we have made a peak and that our children will not outlive you. Sorry for the children, but your children may outlive you. I'm talking about the average, and so when we deal with the population. the fastest spreading disease in human history. And this isn't just our problem, as in the United States. It's an estimated 20% of the world population is diabetic. It's not, usually I get on our back because we eat too much fat and we have too much meat and we're hung up on our protein, et cetera, et cetera, et cetera. This is a world phenomenon. And by the way, the United States doesn't have the highest risk, nor does it have the highest population density of diabetics. Even though it is part of the United States, Eskimos are much higher density of population of diabetics than we have here on the mainland. Samoans, and probably they're too close to their sugar cane, have a much higher incidence of diabetics than we have here in the United States. So if you think we're the worst, there's one thing we're not. But around the whole world, we have this much population of diabetes. Have you ever wondered why you have all these companies that send you news about, may we please send you supplies? Can we please send you a thing to check your blood sugar? Can we please send you this and this? And you go, whoa, what's going on here? What's going on is that is the biggest marketing group for medical care that they have right now. CDC has declared it a pandemic. Now, these words are used: epidemic, endemic, pandemic. A lot of times politicians and people and news anchors throw these words around and don't know what they're talking about. This is accurate here. Pandemic means we have an epidemic proportion of population that is ill with the disease around the whole world. That's what pan means. It is broad and it's around the whole world. Endemic means it's China, a localized population with a serious flu virus. That would be an endemic situation. Epidemic means it's throughout the whole country or that part of the world. 20% of the world's population expected to double in 16 years. There's no end. We're not seeing it peak and come down. See, we saw heart disease continue to rise until the 1970s, maybe into the 80s. Now heart disease deaths, we're talking about here, is on the decline. Not heart disease. We have more people with heart disease now than we did before. It's the death rate. So we've gotten better at stents, better at bypasses, and better at drugs, and we're sustaining sick people longer. That's all we're doing. We're not getting healthier. Cancer is still rising, but diabetes is outrunning cancer so fast it doesn't even have a chance. Percentage of population, this is United States now. Those less than age 20 is less than 1/4, or they're about 1/4% of the population, or about 1 in 400. 20-plus-year-old, about 11% of the population, or about 25 million, and 65 and older group. If you live in a retirement community and you walk around your neighborhood, 1 out of 4 people you run into is diabetic. Different way of looking at it, percent of the group from 20 to 44, about 3.7%, 45 to 64, 13, almost 14%, and greater than 65, we have our number there again, almost 27%. What's the cost? See, right now, if our government would get out of health care, and if our government would get out of education, guess what? You wouldn't have a national debt. That's how big these numbers are now. And you live in a county, and I live in a county. You ever go down and ask the county tax office how they break out your tax dollar? It'll be very interesting. Don't get upset at me, okay? But you're going to find out that those little red vehicles called buses that run around your county are costing you most of your county taxes. That's what I'm saying. If government would get out of education and if government would get out of medical care, you wouldn't have a national debt. 2012, 245 billion. 2017, that's the latest number I've got, 327 billion, and we expect it to go up another 41% over the next 5 years. A few terms while we talk to make sure we're on the same page. We have basically type 1 and type 2 diabetic. you will find that some type 2 diabetics are now being treated as though they were type 1. In other words, you can be a type 2 diabetic and still take insulin. Don't recommend it, but that's what some people do. Type 1 diabetic, we used to call those juvenile diabetics. They make minimal or no insulin. Their pancreas basically is either damaged, malfunctioning for some reason, usually with a virus or an autoimmune type situation. They are insulin dependent. If they don't get insulin, they won't be here. Very small percent of the population. They are thin to normal weight, and most of them begin the type 1 diabetic, that's why they call it juvenile, before they reach the age of 20. When I went to school, we used to say a juvenile diabetic that lasted 25 years was doing good. Well, now we would consider that very, very poor medical care. My record was a gentleman who's no longer here. He died in his 90s, but he was diabetic, type 1 diabetic, for 75 years. So we've kind of proved the 25-year thing that I was taught is a low estimate. Type 2 diabetic, adult. You do produce insulin. You are not insulin dependent. You don't need a shot. This group, without exception, is overweight, and most of the time it's adult onset, 30s, 40s, 50s, 60s. We're seeing a shift now to now I've got teenagers as type 2 diabetic, not type 1. They haven't lost their pancreas. But I'm seeing teenagers who now are called adult onset when they're not adults yet. The fastest growing group of diabetics right now by percentage is the 14 to 18-year-old group. And it's due to what they're eating. They haven't been around long enough to have major disease, I'm glad. It is what they're eating. Symptoms, large waist circumference. A man's belt size, if it's over 40, then we're going to start getting concerned about diabetes. Ladies, I don't know why you get 35 and we get 40. I guess that means we're fatter than you. I don't know what to tell you, but that's the stats. Triglycerides of over 150 milligrams. So if you get your lab work done and they tell you that normal in America is 50 to 150, that's not normal. That is part of the diabetics that are in America that cause that number to be that way. Laboratory norms usually mean, not always anymore because we shift them, usually mean what we call 2 standard deviations. This is statistical talk here. But it means that 95% of the population fall within those numbers. Now you tell me, is 95% of Americans healthy? So the numbers you see on your lab reports are not health numbers, they're population numbers. Please don't compare the two. A good number here, and I think I'm being generous, is 100 or less if you want to know what a healthy number would be. Blood pressure, that's a standard that's been around since I was in school. 140 over 90 or less, and they're saying if you're greater than that, the V going that way. Cholesterol over 200. This is one area where the lab is getting a little bit closer to health numbers, not realistic numbers. And if you watched, just since I've been in school, we've gone from a norm of 300 down to a norm of 200, and my population hasn't changed, so the lab changed for you. How's that? So you go to the doctor one year and he says you're fine. You go back the next year and your lab works the same. He tells you now you need to take Lipitor. Well, I'll tell you why you have to take Lipitor. Well, first of all, you don't. But I'll tell you why you're expected to take Lipitor. And that is we now have a drug that we can sell you to lower your cholesterol. That's why you have to take Lipitor. It has nothing to do with your cholesterol level. I mean, what happened? Weren't you 220 last year? This year you go back to the doctor and you're 220, and now he's got a new drug to give you. Well, what happened in that year? A new drug. Had nothing to do with your cholesterol level. See, that's a lot of what's happening right now. A few more points about type 1. We know it's a lack of insulin. There is no family history. This is not a genetic one. You can have no family history at all and be a type 1 diabetic. It's caused by the islets of Langerhans. That's those cells in the pancreas that make the insulin. They are destroyed, And this number is even less now. It's usually around 10% of diabetics are type 1. Type 2, insulin resistant. We're going to spend a lot of time on that. Definitely a genetic tendency. And I'm not sure it's because if we ate mom's cooking and mom is the best cook, or if it's actually something in the genes. Cause, diet, and obesity. And this is 85 to 90% of diabetics. If you want the best indicator, without going to a doctor and putting your arm out and getting your blood drawn, this is the best indicator for predicting type 2 diabetes. Greater than 0.5 ratio, best predictor for type 2 diabetes with impaired glucose function. So what do we got here? We can calculate, it's your waist to height ratio. So if your height is 70 inches and your waist is 32, obviously you're going to divide 32 by 70 and you come up with what? 0.46. So you're less than 0.5, so that means you have passed one of the best indicators for being and becoming diabetic that you have available. And we can all do this. You can measure your waist at your navel. We call that your waist. And then you know your height. Just simple math you can do. Become your own doctor. Symptoms of pre-diabetic. Hemoglobin A1C. We'll spend a little more time talking about the various testing. Hemoglobin A1C is a hemoglobin in your blood that is changed as a result of your blood sugar level. As blood sugar level goes up, more of hemoglobin is converted into this form. And so when we find this form, it lasts in your bloodstream for as long as your red blood cell lives. Now, if your red blood cell lived as long as you do, then these numbers would be incredibly high. But the lifespan of your red blood cells is 120 days. You get all new blood every 120 days. Well, why do you think God gave you a spleen? You got a whole organ for one basic purpose, taking care of the malformed, could be problem in the formation, could even be a cancer in the red blood cell area. The spleen cleans out. You got a whole organ just for taking care of red blood cells. Because just sitting here this afternoon, you're going to feel really tired because you're probably going to make somewhere in the neighborhood of 1 to 2 billion red blood cells probably just sitting here. So if you feel tired today, you realize you're really working hard and just don't know it. So if your boss asks you why you're so tired, you say, well, since I've been here today, I made at least 1 billion red blood cells already. What do you expect out of me? So 120 days, all new blood. That's why the doctor does your A1C every 3 months, which, by the way, is only 90 days. I'd recommend you do it every 4 months if you want to get a whole new start. So all those red blood cells that had too much hemoglobin A1C because you ate too many banana splits, you say, I'm going to do better. I'm not going to eat one for 6 months. By 4 months into it, you will get much better readings. So we want your reading to be less than 5.5. Blood sugar levels less than 100. By the folks, this is liberal, okay? We're being generous. Ideal blood sugar, from a health standpoint, 70 to 85 area, not 100. So what do we get? Well, when that work comes back, we're 99, and we go, whew, I'm good for another year. No, you're not, folks. You're just choosing to die differently. And I go, don't buy that. See, the problem is we switch from trying to help a person get better to managing illness. Most doctors are into managing illness, not trying to get you better. In fact, they get upset if you use the cure word, or if you use the word walking away, or you see these diabetic seminars. What are they called? Reversing diabetes. Well, if you put something in reverse, it means you're going the other direction. Or overcoming diabetes, all these fancy words they use. Well, most people don't believe that's possible. Well, in over 40 years of practice, I can reassure you it is very possible, and I've seen it repeatedly time and time again. What bothers me is not 100% of the people that see me want to take the challenge. In fact, most of the people that see me, I call it kicking the tires. You know, you go out to buy a used car and you kick the tires and blow the horn and, do that kind of stuff. Well, I see some people come and see me, and I'm going, listen, we don't need more research. We don't need to spend more dollars for the Cancer Society when they knock on your door and say, we're doing all this great research, will you make a donation? I'm going, no, they don't need it. And when the Diabetic Association comes and knocks on your door and say, we need a donation, I'm going, well, what for? We know what to do. What's wrong with you? Had a very interesting conversation. A man came to my door and wanted to sell me cancer insurance. I'm going, yeah, but I can solve your problem. You see, you want to sell me cancer insurance. I'm in preventive medicine. I can tell you how I can have you sell none of your insurance. Of course, that didn't work out for the salesman. I'm going, why would I buy cancer insurance from you? You want to eat with me and have lunch with me? I'll show you what real cancer insurance is. Anyway, it didn't go over too good. Polycystic ovarian or breast disease, these are symptoms of prediabetes, systemic inflammation. If you have to boil it down and be as simplistic as possible, every disease that we have in our body is due to some level of inflammation. Whether it's infection, whether it's autoimmune disease, whether it's coronary artery disease, it's all about inflammation. By the way, leads me to this one, tendency to form blood clots. I'm seeing more and more and more people forming blood clots, not because it's just post-surgery, not because they got hit, not because they had a trauma. They are forming clots, and we go for no good reason. We've got more people on anticoagulants than ever that I've seen before since I've been out of school. I go, what is giving here? Why are so many people on anticoagulants? Is it just because they're not drinking enough water? Are they that dehydrated? Or am I really looking at the answer here? Tendency to form blood clots is because we have so much inflammation in our system. What we eat, what we breathe, etc., etc. Gestational diabetes. I don't know how many of you are planning to get pregnant, but looking at this audience, I probably have a very small group, so I won't take a lot of time with this. This is basically when you put that much workload on your body in developing a whole new child, that it does tax yourself more than what you normally would. So what's happening? What can we learn? It's similar to type 2 diabetes. Obviously, it occurs during pregnancy. Here's the fearful fact, and here's the take-home message. Go back to when you were pregnant. 70% of the ladies with gestational diabetes will go on to be a type 2 diabetic. So look at it as a risk factor and say, you know, back when I was 24, the doctor told me that I had diabetes that was just due to being pregnant, and I want to take that for a warning. So what's the best way to deal with the warning? You go, what can I do to avoid diabetes now that I'm 44? And when I was 24, this happened, and I'm still not diabetic, so maybe the doctor was wrong. No, the doctor wasn't wrong because he didn't make up the numbers. We're looking at life expectancy. By the time you reach 80 or 70, we expect these numbers to work out. You can see what's happening. Remember I told you it shifted. We're shifting away from type 1 diabetics and juvenile. They're becoming a smaller population. This data represents 95% of diabetics. The body produces enough insulin. The body responds by producing more insulin for a while. And then insulin production cannot overcome resistance. When does that point take place? When do you know when you cross over that line? Your fasting blood sugar can't tell you. Your A1C can't tell you. Now you know why we use the height to weight ratio. And that's how we know we've got over 80 million people in the United States right now that are walking the road of what we call insulin resistance. See, you don't become insulin resistant one day and go to the doctor the next day and he proclaims you're a full-blown diabetic. Sometimes it can take up to 10 to 15 years of abusing my body before I finally get the results. I used to do a lot of stop smoking classes. It always would interest me. I knew that if a person, every time they smoked a cigarette, they would turn green, I'd have a lot less people smoking. You know, you just put that in your mouth and take a good deep, and all of a sudden you turn green. So I was wishing, how can I get people to be as concerned about their lungs that they can't see with their complexion that would bother them? They go, oh, there goes Bob. He must have smoked this morning. He's green again. See, we don't have that kind of feedback. And so diseases have their way of creeping up on us, and we are living with them for years and years and years. And then we fall off the cliff and we go, oh, what did I do? Oh, it must have been that last cheeseburger I ate. No, it wasn't anything to do with that cheeseburger, you know. I like this symptom. No symptoms, or no symptoms that you observe. Fatigue, well, that's so common. How can I blame that on diabetes? Well, it's just one of the symptoms. Increased thirst. Well, that's a pretty definite one. Polydipsia, you know, we got the three biggest things: increased thirst, increased urination, and if you're severe enough, you can actually get increased hunger because you are urinating out so much of your glucose, your sugar. Increased urination, blood sugars above 200, and fasting blood sugars above 126, confirmed 2 times. By the time that happens, you've crossed your 10 or 15 years of abusing your pancreas, and you're actually in this zone over here of exhausted pancreas. And then what do? We get out the metformin and push you to the maximum dose. So we get in there and we give that pancreas another good kick. You know, I don't know if you guys watch horse racing. You ever watch the jockeys in Kentucky? What they do to that poor horse? They get out a bigger whip. A lot of the medications that we're giving people right now literally are just a bigger whip. One of the biggest whips is your steroids, prednisone and cortisol. Complications, heart disease, and 80% of heart disease and will die from it. So when you see diabetes, look for heart disease. If you see heart disease, look for diabetes. Stroke, 2 to 4 times. High blood pressure, 67% increase. Blindness and eye problems, 28% increase. Kidney disease, leading cause, 44% of new cases. The kidneys are an organ that actually take the blood sugar out of the bloodstream when it goes through and then put it back in the bloodstream when it leaves the kidney organ. When you cross a certain threshold, and that threshold's about 160 blood sugar level, the kidney does not have the capacity to get it all back in, and then we do a urinalysis on you, and what do we find? Sugar in the urine. That process is very damaging for the kidney. The other thing is that these people have high insulin levels trying to make up for the disease, and insulin changes the functioning of your kidney tubule. That's the filtering, the glomerulus, that is the filtering unit in the kidney. Why do you think we have so much osteoporosis in this country? Did you know that the higher the insulin level in these, quote, pre-diabetic people, that I've got close to 80 million of them, causes a change in the kidney tubule and you excrete more calcium. In plain English, you urinate out more calcium when your insulin level goes up. So that chocolate bar you ate just lost some of your bones. And you go, wait a minute, but that was made with good milk. It must have had some good calcium in there somewhere. No, it doesn't. It overworks the kidneys. 44% of new cases is due to diabetes. Complications, nervous system, 60 to 70% of nervous system damage. The part of your nervous system that you don't want to damage, well, I take it back. I don't want to damage any part of my nervous system. But I also would like to keep my nervous system from here up. Okay? Look at diabetes and dementia, and if that doesn't make you reconsider what you're going to eat for supper tonight, then I'm not sure what can help you, okay? Because I don't know, I mean, how much have you spent on your brain lately? You know, if you ever had to pay back student loans, you should say, that's how much I spent on my brain. Going through Loma Linda, believe me, you spent a lot on your brain. Now you're just going to go lose it? No. Diabetes, insulin increase, insulin insensitivity, insulin resistance, whatever you want to call it, is tied so closely to your mental faculties that we wonder how the brain can survive. What the brain does is something very interesting. When your blood sugar level goes up, the brain can't handle high blood sugars. It's not works that way. So it actually decreases the amount of glucose that can get to the brain. Because if it didn't, and a person's blood sugar level was 500, there's no way the brain can handle that. You would be in a coma. So the brain decreases the fuel supply. When the brain decreases the fuel supply, what happens to the brain tissue? It shrinks. So now you see the CAT scans on people's brains and you go, oh man, what's happening here? And then the radiologist, in his own way, will write, brain size appropriate for age. That's the worst thing you could say. Because what does he see? He sees your brain and my brain, unless we do something about it, getting smaller and smaller and smaller as we age. So it says when it says age appropriate, that's like slapping me in the face. I don't want an age appropriate brain. And neither do you, by the way. I want a brain of a 20-year-old. Hopefully it was good then, right? Amputations, 60% of non-traumatic limb amputation. By the way, Medicare doesn't pay for many things better than 80%. Guess what Medicare pays for amputations? 100%. You figure that one out and we'll both be better off. I can't believe it. Mobility problems. If you can't walk, we got a major problem on our hands. People that can't walk are dying. Depression. You have a depression seminar coming up here. It's a great seminar because you know why it's great? Because it's going to ask you to change your life. Because the way you work your way out of depression is you change your life. So it's a lifestyle approach, highly recommended. Complications of pregnancy, large babies, biochemical imbalances, dental disease. Diabetics have 2 to 3 times the periodontal. Now, I've got a dentist here today, but my understanding is that when you hit about 50 or 55, you're less worried about how many cavities you're going to get in your mouth. And please, please start paying more attention to your gums. See, in your younger years, your mother tells you to brush your teeth, and she did right. Well, I'm going to tell you, when you get to be over 50 or 55, you brush your gums, and don't forget about your teeth, but the point is, take care of your gums. Diabetics have gum disease, which affects the ligaments that hold those teeth in, and I don't care how good that tooth is, if it's loose and falling out, it's not going to help you. 2 to 3 times the periodontal disease. Diabesity. That's not a word, by the way. Obviously, a metabolic dysfunction that ranges from mild sugar imbalances to full-fledged type 2 diabetes. The reason I say diabesity is because this is a type 2 diabetic, and it's because I've got my insulin receptors on my cells are not working correctly due to carrying too much weight. Insulin resistance. If you want to know the key to treating diabetes, it's right here. To reverse diabetes, you need to understand this. Resistance syndrome, energy intake is greater than energy expenditure. So I've lectured here enough, and I've lectured enough about cabbage that you think that's probably all I eat. Well, I eat a lot more than cabbage, I assure you. But the point, and that is my classic food, because I get much more nutrients with a lot less fuel. So this equation you see here, energy intake, energy spent. My energy intake is a lot lower, but I still get all my nutrition to run the body than this. You explain to me how the POWs, and I don't think they're all lying, come home and tell me they've lived on this soup that you can't even call soup for years and survive. There has to be something in the body that conserves energy beyond what we can even imagine. Maybe the angels kept them all alive. I don't know. But the point is, energy intake for us is usually a lot more than the energy we spend. We have continued to defy the second law of thermodynamics all the time. We expect to be able to eat more than we expend, and nothing should happen. You're not out of focus. It's my slide. What increases insulin and what decreases insulin? Because this is the essence. A high-carb diet. Now, when I say a high-carb diet, and they say high-carb diet, they mean high-sugar diet. I'm also going to turn around and show you that I want you on a high-carb diet, but it's called broccoli and Brussels sprouts and cabbage and cauliflower and carrots and tomatoes and any vegetable basically you grow in your garden. High-calorie diet increases insulin. Frequent meals and snacking increases insulin. Sedentary lifestyle and empty calories. You go, well, thanks a lot, Doc. That's me. Well, let's look at this. Decreasing. Low-carb diet. Eating more vegetables. Low-calorie diet. Consolidate meals and intermittent fasting. We're going to spend some time on that. And high-intensity exercise, because you burn a lot of glucose and you decrease the insulin requirement. And high nutrient density. That's a nice way of saying cabbage. High nutrient density, low fuel. Insulin response to macro, large nutrients, your big ones, okay? Not your down near your vitamins and minerals. Fat intake causes the least amount of insulin response. Now, when I was in school, guess what we were feeding diabetics? Guess how I was trained? I want them on high-fat, high-protein, low-carb diet. So I did my doctoral dissertation on diabetes, and guess what I found out? My professors were wrong. So I started putting my patients on a high-carb diet, low-fat, and adequate protein. Got confronted in the hall. We had a clinic there in Southern California, and one of the older docs, I was the rookie on the group, one of the older docs came and stopped me in the hallway. He says, why'd you take my patient off insulin? I said, she didn't need it anymore. I mean, I can't honestly give someone insulin and watch their blood sugar go down to 20 and need an emergency visit. But I got the point. And you know the point was? You're messing up, Collins. I'm going, well, if that's the way it's got to be, I'm going to vote for the patient. Because I can't sit there and have a motivated patient and tell them what not to do so they can stay on their insulin. So you make some decisions along in these careers. Fat and protein, for this logic, that's what they put people on, and then they put them on the least amount of carbohydrates. And here's one of your tips here. It says non-fiber. Now, obviously, fasting is one of the best ways to burn fat because insulin and fat burning go hand in hand. The higher the insulin, the less fat you burn. The lower the insulin, the more fat you burn. So, fat storage is in the red, fat burning is in the green across here. And we'll put some more answers to this particular slide. Now, traditional eating, you're fasting through the night hours into the morning, you have breakfast, and your fat goes into storage because your insulin goes up. You have a little break in between, and then you have lunch, and then you have dinner, and then you go into the evening hours. That's if you're eating within a 12-hour window. Most Americans eat within an 18-hour window now. They eat and eat and eat and eat, and you can't go to bed hungry, you know. That's something like a sin or something, you know. Now, what happens? Plasma insulin levels, and down here, hours spent in the fasting state. What happens? Well, we know that insulin levels start to drop. 70% reduction in insulin levels occurs in the first 24 hours of fasting. So in plain English, when you drop your insulin, you start burning a lot more fat. This is why when I treat a type 1 diabetic, it is so delicate, because I want to give them enough insulin to take care of their blood sugar level, but I don't want to give them more than what they absolutely need, because they'll never lose weight on me. Because you're driving it into storage. The goal of insulin is to take sugar out of the bloodstream and put it into the cell and have the cell store it. Now, it doesn't store it as glucose, possibly a little bit of glycogen in some cells like the liver. It stores it as fat. Fat storage is a much more efficient fuel storage center than glucose. If you stored all your fuel in your body as glucose, we'd all weigh about 500 pounds, and you wouldn't go for that, okay? So fat is an extremely efficient way of storing fuel. That's why your body does that. The normal range, once again, fat burning. You're going to burn more fat when your insulin, here it's 300, 200, 100. When your insulin gets down here around 5 to 7, you can see that you're going to burn the most amount of fat. As the insulin starts to increase and starts to go this way on the chart, your fat burning continually goes down and down. And so when your insulin's at this level, you're only burning about 20% of the fat you're burning here. Think of it just the opposite. Insulin up, fat burning down. Insulin down, fat burning goes up. Now, why do I want you to burn fat? Because fat in the body equals insulin resistance. Not muscle. It's the extra fat that we have. They've just written out here. Can use body fat for energy when the insulin is low. Cannot use much body fat for energy as the insulin goes up. Now, ketones are a fuel from the breakdown of fats. You've heard a lot about ketogenic this and ketogenic that and keto whatever. Well, first of all, ketogenic and ketones are a very poor fuel for the body. It is an emergency fuel that needs to be used when you have an emergency, kind of like when you're starving to death, okay? Like when you're a POW, all right? But ketones are not the best food for the brain. So all this ketogenic stuff, it's also not the best fuel for muscle. But we do it because why? Why have so many people had success with ketogenic diets in our country? Well, I think it's a good question because I had to answer it for myself. First of all, the research doesn't bear out what they're saying. Less heart disease, less cancer. The data are showing that people on the ketogenic diet have more heart disease, have more cancer, have more problems. But anytime you take a person and you take 100 pounds off them, I don't care what their disease is, they're going to do better on the blood sugar level. No doubt about it. That's not even up for debate. But back to the ketones. Ketones are a natural breakdown product from your fat metabolism. The body uses them. In fact, it expects to have some. But the reason the ketogenic diet works is because, I hate to say this, because it's not a good statement. It's because we Americans are so sick that we can go into ketosis and actually do better because how sick we are and how insulin resistant we are, and we get some benefit from that. Never supposed to happen that way. So what I'm doing and what I'm telling you is that they are using a sick population to put into ketosis and tell them they're doing better when they should have never been that sick to start with because they had bad habits. Kind of frustrating for me, but that's okay. Glucose levels, it says hard point before switch. And what they're really saying here is that when you're fasting, you start out here. This is total hours of fasting. You start out fasting, you fast for 1 day. Your glucose level is coming down, and then your glucose may go up. You're still fasting, and it'll fluctuate, and it keeps coming down, coming down, coming down. And here's the crossover point. At the 3-day point of fasting is where your ketones are actually going to take over the major fuel supply for your glucose. I don't know how many of you have fasted for 3 days, but first day, piece of cake. You may not even miss it that bad. Believe me, it's not that bad. Second day, you start going. Third day, you go, you know what? Food is a pretty incredible thing. I think I could use some right now. At this point, 72 hours, ketones take over. Okay, you have an extra spare, so you were making enough ketones. Why did you get so hungry if you have all the fuel you need? Well, I hope you're coming to the same conclusion I am. Ketones are a poor second best for fuel in your body at best. If you're lost on the Appalachian Trail, well, you'd be off the trail. Hopefully you could follow the white markers. If you're lost and you have to fast for 3 days because you don't have food, then you are thankful for a secondary fuel. As we go along, at the 4-day point, we end the fast, and you see what happens. Glucose, we start eating, blood sugar takes off and goes up, and ketones keep on going. So what are the benefits? Yes, you're right. I'm trying to talk to you into considering decreasing your insulin levels by fasting. You can spend big bucks and go to Atlanta, and I think the doctor's name was Dr. Horowitz. You can go to his diabetic program, and you can spend probably $5,000, and don't ask me because he's not spending much on food there, because guess what you get to do? Well, on day 1, you don't get anything to eat. You get water, minerals, probably some vitamins, make sure we keep you in electrolyte balance. On day 2, you don't get anything to eat. And we keep monitoring your glucose, and at some point, we're going to take you off your medications. And on day 3, you don't get anything to eat. You go, wait a minute, I paid, this is pretty, ritzy place. They want $5,000 for the week, and I haven't got my first meal yet. You feel like you're starting to get ripped off. And by day 5, within 5 days, this is type 2 diabetics, not type 1 where you have to have that shot. We're not debating that. This is type 2 diabetics. Within 5 days of his regime, they're off all their medication. So what's happened? The pancreas is finally able to keep up with the demand, and your insulin resistance goes down a whole lot quicker than losing all that weight. How much weight do you think they lost in those 5 days? 5 pounds? Maybe. That would be good. That'd be a lot. So it's not because they lost 5 pounds. They went in there at 200, and now they're 195. Don't tell me that's enough to give all this great results. It's kind of different. It's like going to school and getting your PhD when you finish first grade. You get all the benefits of having all your weight off in 5 days. No, I'm not recommending a 5-day fast. I'm recommending you consider fasting 1 day a week, and we'll show you some regimes. Why am I recommending this? There is no better way to turn your metabolism around and make it work for you. And you might want to practice. Well, I don't like to practice being hungry. Well, appetite is a powerful force. I happen to believe it's a God-given force, and I also happen to believe that I have messed it up, and maybe you have too. I've taken something good like my taste buds and messed them up to where I think that good food doesn't taste good and bad food tastes good, and somehow, Did any of you parents ever have to train your children to eat sugar? Why do you think that? Almost every other food, how about the Brussels sprouts? What'd you have to do? You got to eat that before you get your sugar, your dessert, right? So what's the reward? We train people very young that sugar is what? Sugar is fun. Sugar is family. Sugar is social. Sugar. You see what I'm getting? We have so many emotional ties to a physical food out here, and we do well. And we get ourselves confused. Number 1, purging of cancerous and precancerous cells. This isn't Mike's. I'll be back to lecture on cancer, but just a peep view. Right now, they are using fasting prior to chemotherapy. We're not going to debate using that or not right now. They use fasting prior to chemotherapy to do what? because the cancer cell is a big pig and it's a parasite, and it will get hungry quicker. It will also starve quicker too, by the way, than a normal cell. And when you starve the body, when you fast the body, guess who's going to want to eat most of the chemotherapy? Especially if I add a little bit of sugar to the shot. We haven't got it down to specific targeting and specific cancer cell, but this is getting pretty close. When we can target cancer cells by starving the whole body and give it. Another way that doctors are doing it is they are giving insulin to people who aren't diabetic. Because when I give you insulin and you don't need it, I will drop your blood sugar. And then when I give you the chemotherapy, guess which cells are going to suck up the sugar the quickest? And guess what I do? I put the poison with it so that now I'm poisoning less of my healthy cells and more of my cancer cells. Interesting concept. Number 2, a rapid shift into nutritional ketosis. We talked about that. Decrease in fat tissue. That's where the ketones come from. Increased gene expression for longevity. Folks, we got all the genes you need in your body. Some genes are going to promote cancer. Some genes are going to promote inflammation. Some genes are going to promote heart disease. How about let's turn those off? And why don't we turn on the genes that are for longevity and health span? It's your choice. And you make that choice by what you're going to have for supper. I don't know, maybe some of you are fasting. Maybe you already heard my lecture before I got here. Number 5, autophagy and apoptic cellular clearing and repair. Well, they're using some medical autophagio, automatic or self-eating. You want your immune system to clean up bad cells? That'll do it. If you want apoptotic, that means the death of cancer cells is very unique. When the genetics get changed from a normal cell to a cancer cell, they a lot of times do not take the normal lifespan genetic code with it. So not only is cancer cell a big pig and want to eat your lunch for you, and the next cell's lunch and everybody else's lunch with it, it also lives longer. So by fasting, I can change the genes to make it die quicker. So if I can't get rid of it, at least kill it off, and then you can get rid of it. Number 6, improve insulin sensitivity. You don't need as much insulin. Decrease in oxidative stress and inflammation. This is all fasting. And I hope number 8 will get your attention. Enhance cognitive effects and neuroprotection. Do you like your brain? How many of you have relatives that is painful to your heart because you go and you visit and they don't know who you are? That's painful. And if you don't know who you are and no one around you, then what do you have? What is life about? Life is about having a memory. If we don't have a memory, well, we don't have much of a life. Our heart may still beat. Fasting, and what happens to the insulin dosage, okay? So obviously these people are either type 2 or type 1 diabetic. I'm expecting they're type 2 diabetic. And this number of weeks on IDM stands for Intensive Dietary Management. I don't know why they picked that one, but that was a good way to say it. But look what happens here. Fasting, as it comes down, here we are at 1 week point. And by the way, they're saying fasting up here, but they're saying number of weeks on IDM. That means people have many different definitions of fasting. Some people do 40 days of Lent. And their 40 days of Lent, they say, well, I'm not going to eat any meat. I'm going, well, I've done that for 60-some years. You're having a long Lent. So you see my point. So there's all different definitions of fasting. When I say fasting, unless I qualify it, I'm talking about hydration, and that hydration is water. Oh, well, I do fruit smoothie fast. Well, I'm glad for you, but that's not fasting. That's food. I'm glad you like yours in whatever form, but that's not fasting. By definition, fasting means you're not consuming food. So back to the diet. from 120 units of insulin down in 1 week of being on this program, their insulin needed to normalize blood sugar dropped to 20 in 1 week. And they weren't fasting as in a full water fast. And after 3 weeks, here. Now, it's not fair, but I want to show you something about A1C so you don't get upset. You're not going to go from 7.0 to 6.6, a 0.4% drop in 3 weeks, and go, I'm a failure. I'm going, no, you're not. Remember I told you it takes 120 days for those cells that you messed up over here to get out of your system. Don't expect to get them out of your system in 3 weeks. Don't go back to the doctor in 1 month and get your A1C done. That's asking to be embarrassed. Don't embarrass yourself. You could have been on a perfect program, whatever that is, in 3 weeks and not got better than this. I'm glad it went down because the new cells that are coming on board all those 3 weeks aren't messed up with the high glucose. Just to give you a little what they're saying, the intense dietary management program that they had the people on focus on dietary intervention, including a combination of dietary strategies. Folks, this is not diabetic. This is called living, okay? Eating whole, unrefined foods, increasing your intake of natural fats, get your olives and your avocados, lower your intake of refined grains. It just says lower. It doesn't say avoid them. And avoid added sugars and do some intermittent fasting. That's not a diabetic program. That's just common sense. We haven't got, if that's a fast, then I hope that everyone is fasting all the time. Insulin levels increase with obesity. Okay, increase in body fat going along this, increase in belly fat, get a little more specific, and you're fasting insulin. Why is it fasting insulin levels? Because if you eat anything, your insulin will go up. So we've got to have some baseline because you may have eaten a Babe Ruth bar and this person may have eaten a carrot where you're going to get a different response. But fasting insulin levels are high in people who haven't even had their meal yet. That's how you know you're dealing with a diabetic. Now here's the point. Your fasting insulin starts to go up as much as 10 years before you get a glucose level that would pass you off as being a diabetic. 10 years of running time before your pancreas gets so upset with you, it fires you. No. Sometimes I wish that just for one day, your organ could talk back. What would your stomach say about you? Worse yet, what would my pancreas say about me? I've had my share of banana splits. I don't even know how many years ago since I had one, but you talk about a pancreas attack, that probably would be as close as you're going to get. Okay, now let's break it out in time intervals. If you're having a 16-hour fast, how many hours do you get to eat in? This is per day now. Obviously 8 hours. So during a insulin level here, when you're in your fasting mode, the insulin level is going to be low. And then you go with lunch and snacks and dinner and soft drinks, and then you're back into your resting phase again. Some people have chosen to eat within an 8-hour window. What that means is the other 16 hours, they're able to be in, quote, fasting mode, but believe me, you're coasting, but you're still having lower insulin levels. One way to handle it. This would be the way to handle it if you truly are a diabetic and would like to reduce your diabetic medication, if you'd like to lose pounds, if you want to not be called a diabetic anymore. And by the way, those of you that are less than 65, never get diabetes put on your medical chart. You know why? You will pay dearly for it. Here's another tip. Don't go to your doctor and ask for an antidepressant until you think there's no other way, because that gives you a psychiatric diagnosis, and that will stay with you until you reach 65, and then they don't penalize you anymore for your medical insurance. A lot of people don't realize that. Don't ever go to a doctor and expect not to get penalized on your medical insurance, okay? On the other hand, if you need insulin, you go and you get it, Okay, I'm not telling anybody to die. I'm just telling people go in there and they're quite reckless. And then they go, oh my, I went to get health insurance last month and they told me it has tripled. Well, why did it triple? I haven't had a bypass surgery. I don't have cancer. Why did it go up so much? Intermittent fasting. Intermittent fasting increases leptin levels to reduce overeating. Leptin is a chemical that's put out by your fat cells that tells your brain you've eaten enough. You go, hey, you have any pills like that? No, I don't have leptin pills. Leptin is the compound that continues to go up. Now, I've studied the brain enough that the brain can get leptin resistant. If you keep ignoring what the brain is being told, please stop eating. Next day, please stop eating. Next meal, please stop eating. Guess what happens? The brain gets to the point where we're going, they don't listen to me. The leptin is going to be up. I'm not going to pay any attention to it. So it can get that bad. Number two, insulin and leptin sensitivity go up, lowering the risk of diabetes, heart disease, and cancer. And we also get an increase in the ability to become keto adapted, turning your body into a fat burner. In other words, when you're fasting, you're going to be burning more fat. Decreases from intermittent fasting, we lower our triglycerides, our blood fat floating around. We lower our heart disease risk. We lower inflammation and free radical damage, whether it be joint, muscle. We decrease weight gain and metabolic disease risk decrease. So what's the example? Look at this at the bottom. Fasting, 7 to 8 a.m. You go, wow, that's only an hour. I can handle that one. Well, hang in there. You work out for an hour, without eating, by the way. Your eating window is from 9 to 3. So how many hours is that? Research that came out, probably 20 years ago now, showed that people that eat for 6 hours or a 6-hour time span, meaning they're fasting for 18-hour time span, have significantly less cancer. So it's not just about diabetes. What I'm suggesting here, changing your life will affect everything, like we said in the other chart, from your brain to your blood sugar. So the eating window is 9 to 3. Now, if you're not retired and you go, they're not going to let me eat at 9 o'clock in the morning, I work. Well, so do I. You may have to shift your eating from 6:30 in the morning before you leave, and then 12:30 at work. And then you go, what am I going to do the rest of the day? Well, you know, I'm standing before you today, and I can prove to you, because I'm standing here, that I've never died during the night without supper. I'm living proof. I have never died at night yet. Isn't that amazing? I think you don't believe me. This isn't my brother. This is really me. I have not died at night for not having another meal. Some of you are laughing at me. You fast from 3 in the afternoon to 10 p.m. They're trying to make it nice, okay? And then they tell me I'm going to get to go to sleep, okay? Here's the way I would do this chart. Let's be fair. I'm fasting from 3 o'clock through my night all the way to 8 o'clock, including my workout, and then I get to eat breakfast at 9. They're just trying to soften the blow here a little bit. The bottom line is you're fasting everything but what you see in the green. Now, wait a minute. How in the world can you work out the next morning after you have fasted for nearly 17 hours? How does that work out? Guess what? You have plenty of reserve, and you can do whatever you want to. Now, the weightlifters will tell me that if they eat their protein shake and their protein bars and go lift, they can actually lift more weight. Guess what? I believe them. I know that protein is an incredible metabolic stimulant. And so I offer them, why don't you just take some methamphetamine? You may be able to lift more. You see, the logic is not good. If your only goal is to lift more weight, then what will you wind up with? More steroids, and you see that a lot in that field too. That is not the answer. But if your goal is to lift more weight, you can prove some of my theories wrong, but you won't prove me wrong about health. Where's that optimum point? The optimum point for fasting, they call it the sweet spot. The optimum sweet spot for fasting is between 18 to 24 hours. And so that day that you truly are fasting for a day, the last 6 hours that day is where you really get your maximum response for that. I'll tell you how I work it. Maybe you want to do the same. I eat breakfast this morning. Say I ate at 7 o'clock. And then I go the whole rest of the day, go to bed, wake up, and get breakfast again. That's 24 hours. Now, some people don't calculate it correctly. They won't eat. They'll eat their evening meal, and they go, I'm going to fast the next day. They fast all that day until the following breakfast, and how long have they fasted? 36 hours. That's not a 24-hour fast. That's a day and a half. You may want to do the opposite. You may eat your evening meal and then get up and go all the way to the following evening. However you want to work it. I just want to make sure you got 24 hours and don't think I'm trying to torture you, okay? Sleep deprivation has an incredible effect on your pancreas. And how many of us are chronic sleep-deprived people? We keep telling you, not trying to be your mother, you need 8 to 9 hours of sleep. And you go, wow, that would be nice. It's not a matter of being nice, it's a matter of having health. Men who slept only 4 hours a night ate 22% more calories the next day than they did with 8 hours of sleep. Same man. Now do you realize why 2/3 of us in America are overweight? We're sleep deprived. Studies found that a single night with only 4 hours of sleep led to insulin resistance in 75% of the men and women in their 40s, and I want to also add, that weren't diabetic. They were less able to move sugar into their cells, obviously. Insulin resistance can lead to heart disease, diabetes, etc. Here's the chart. Insulin concentration in the bloodstream, sleep versus insulin resistance. Why do we say insulin resistance? Because if the body's got to put out this much more insulin, then it must be calling for it. It must not be working as well. It's resistant to function. So with 4.5 hours of sleep, you put out 71 units of insulin versus an 8.5 hours of sleep, you put out approximately 1/3 that. So sleep-deprived people can have high insulin levels. And what did we already talk about? Insulin and fat burning. When insulin goes up, fat burning goes down. When insulin goes up, you can't lose weight. When insulin goes up, the food that you do eat is going to be around longer than what you want it to. And what do we get? Not taller, by the way, we get bigger. Dr. Jordan, State College there in Pennsylvania. Those who are participating in a weight control program snack less during their evening meal preparation if they had as little as a 10-minute nap before preparing the meal. Folks, when you're tired, just plain admit it and go to bed. Don't try to eat your way out of it. Don't try to coffee your way out of it. Don't try to amphetamine your way out of it. Just admit you're tired. It's like when I eat food, you know, people do all this fancy stuff to food. And they get out the salt shaker, then they get out the pepper, and then they get out the hot sauce. And they got to go, listen, is your food that bad that you got to cover it all up? I mean, if it tastes bad, you got bad food. Just admit it and give it to the dog. Well, like your dog. Just get rid of it. If food needs salt, something is wrong with it. You have done something. Maybe you overcooked it. By the way, have you noticed that cooked foods have lost so much flavor that we salt them so well so we can get a little bit of flavor back? Try a fresh carrot. You'll be surprised. If you don't eat salt for a month, then you will be shocked how salty your cooking or your wife's cooking or whoever's cooking is going to be. It's amazing. I'm going to skip this slide because I want to give time for thing. And we're going to open up after we cover this slide, and we'll go from there. I want to show you the reality of what can happen. in a relatively short period of time. No, I don't expect you to go to Atlanta and be on a 1-week starvation program, okay? First of all, I wouldn't pay someone to starve me. I'm not going to pay money to starve. I'm too cheap or whatever, okay? I can do that at home all by myself. Yes, I may want to get my blood drawn, check my electrolytes or whatever. A person who is a severe diabetic, yes, I would like them not to do it at home on their own. I will admit that. But the point is, I'm not going to pay someone to starve me. So, percentage change from baseline and weight. So we start at 0, okay? Minus means we're losing weight. How many weeks? Obviously, 1, 2, 3, 4, 5, 6. On this side over here, it says percentage change of glucose, baseline glucose. How much did my sugar change? And this is a percentage. So on day 1, week 1, or day 0 here, what happened? Well, let's look at 1 week. The squares are your weight. You lost 3% of your weight. So if you're 200 pounds, you would have come down 6 pounds in a week. That's a pretty good week. But have you noticed the glucose? The 6 pounds off in 1 week dropped your glucose down to minus 40% or 40% off. In 1 week, your sugar that was at 200 is now 120. You'd be jumping up and down and say, maybe Collins does know what he's talking about. I get to see this in the office. I wish you could sit beside me some days. Now let's go to week 2. The weight has come down another probably almost 6%, and the blood sugar is now dropped over 50%. Week 3, week 4, week 5. Let's go to week 6. I need 6 weeks of your life. How are you going to spend the next 6 weeks? The same way you are now? Or you can be a new person in 6 weeks. At least prove me wrong, okay? Take the challenge. I won't even charge you for it. After 6 weeks, blood sugar levels were down 54%. So if you start at 200, now you're not diabetic, folks. They can't call you diabetic anymore because your blood sugar is now 96. 6 weeks. Your weight is down, let's see, it's come across here. Your weight is down about 10%. So in a 10% weight loss, so you went from 200 to 180, but you got all the benefits of having over a 50% drop in your blood sugar. It doesn't get better than this, folks. It doesn't get better than this. And this is for diabetics. This isn't for someone else. You don't want me to lose 50% of my blood sugar because I'd be laying on the floor asking you to give me something, okay? This is diabetics that do this, not people with blood sugars that start at 80. Anyway, let's go ahead and open for questions. Stand up, stretch a leg, do whatever you need to. There's water on the table. So let me, I probably have more that I'm going to cover anyway, but we'll get through as much as we can. Yes, go ahead, Joy.
Tea during the water fast?
What's that?
Can you do herb tea or just water?
When you do a water fast, the question is, should you take your supplements during a water fast? Typically, you don't do supplements while you're fasting. Now, that doesn't mean that if you're on blood pressure medication and your blood pressure spikes after that, you may want to continue with that. On the other hand, like I showed you, after a week, a lot of times you will see such a great change in your medication that I do want you checked. You don't take the same dose of metformin on Monday if you fasted all week till Friday because you will be in trouble. So what I'm advising here, I'm expecting you to use your mind and say, listen, I'm going through a radical change. Therefore, I have to check my blood sugar level more often to see where I'm at. Because it is not unusual, believe me, it's not unusual for a person to drop their medication in half in a matter of 3 days. That is not unusual at all. So if you're not comfortable, need medical supervision, please get it. But if you have been diabetic for a while and you know yourself and you check your blood sugar and you go, I'm already adjusting my insulin because I have the sliding scale, same concept we're dealing with here. You're already adjusting your medications. General rule, I want your blood sugar, first step, to be down to 120 fasting. That's past the first test. The second test I want you to pass is have your blood sugar down to 100, fasting blood sugar in the morning. The third test is I want your 2-hour postprandial, 2 hours after you've had a meal, I want your blood sugars down to 160. Of course, I want to get them on down to 140. That's the steps we move through as we go through this. Anyway, that's what I do in the office too, so I can't spell it out for each of you here. We got a microphone. Pastor Glenn's got that if you want to ask a question or stand up. Yes, right here. I'm sorry, go ahead. I'm sorry?
I'm having trouble getting to sleep since my husband passed away almost a year ago, and my sleep levels completely changed. So how do you get more sleep? I can lay in there, but I don't sleep.
Let me give you some general suggestions, and hopefully it'll apply to you personally. Number one, you have to condition the mind to sleep. You can get too tired or too emotionally stressed to sleep. There's no doubt about that. On the other hand, setting a sleep pattern is absolutely critical for the brain. So if you want to be in bed at 10 o'clock, then we give you melatonin at 9 o'clock every night, whether you need it or not, so to speak. We're resetting the circadian rhythms and resetting and resetting. And believe me, the brain can be reset. That's the first thing I would take. If that is not helpful, then I would tend to go natural way. I would tend to use either kava kava or valerian or one of the other herbs to use that has a calming effect on you and your brain, that type of thing, from that standpoint. Some people do real easy. They can just drink a cup of peppermint or spearmint tea in the evening before they go to bed, and that's just enough to relax them. Other people expect to be able to go wide open and then go pass out somewhere near their bed and go to sleep. Well, remember when you had children, you didn't expect them to go to sleep, just, play hard and jump in bed and sleep. No, what you did? In the evening, I'd watch what my wife did. 5 o'clock, she was putting those kids to bed. Well, they didn't know it yet because they got their evening meal. And then at 5:30, they got their bath. And then at 6 o'clock, they got their Bible stories. And hopefully I was home by then. And then by the time 7 o'clock rolled around, what had happened to their brain? Man, you had them on the slide and it was greased and it was 7 o'clock in bed. And the reason, I will admit, part selfishly, I wanted some time with my wife. So the kids need to be in bed. Well, we made a rule with our kids. You go to bed at 7, you can get up anytime you want to. And yes, it did happen. Sometimes we'd hear the kids playing in their bedroom at 5 o'clock in the morning. That's okay. That was our deal. You go to bed at 7 and you get up whenever you want to. So the same thing with an adult. What is your wind down methodology? What are you doing to calm the brain down? Don't forget, we're still big kids, okay? So hopefully that helped a little bit. Susan?
I heard that it's important to eat within an hour of getting up in the morning. Is that true?
Is it important to eat within an hour of getting up? It depends on your activity. If you do exercise for an hour in the morning, I'd recommend you do that before you eat. As far as the metabolic effect, the sooner you eat in the day, the higher your metabolic rate. And that will definitely be helpful. But tying it down to 60 minutes versus 90 minutes, I'm not sure you're going to get that much benefit from that standpoint. Most of us, let me back up. If you don't sleep well, it may have to do because you've got your digestion working all night too. But if you don't eat too late, you actually wake up in the morning where you might want to eat something. And if you follow a kind of program that I've done, and if you eat at 12:30 or 1 o'clock or even 2 o'clock in the afternoon and don't eat again until 6 o'clock the next morning, the oatmeal smells and tastes pretty good. But when people come in the office and say, man, I just can't think about food. I said, well, if I was your stomach, I'd probably puke on you too, because you fed me till midnight and you made me work all night. I'm really upset with you. Okay, fair, that's fair, I'll stop it. So if you treat your stomach correctly and don't make yourself work all night, you may wake up with a little more energy. By the way, outside of the brain, digestion is your most highest fuel-consuming process in your body. So if you want more energy, stop eating. You go, that doesn't make sense. I thought I was supposed to eat more fuel. Well, at a certain point, that's true. But no, remember, Digestion takes more energy away from you than even your brain. And you want to put them in competition, we got a big problem. I overeat, and then I come to church on Sabbath morning, and it's nice and warm in here, and what does the pastor have to put up with? You know, in the old Baptist churches, we had that thing, you bong people on the head, you know. The deacon would come down the aisle, and he'd have a pole. He'd bonk that one on the head. Well, I never got bonked on the head, but it may not be a bad idea, because I tell the pastors when I come to their churches that I'm helping them, because he sees all of you guys yawning. Anyway, I'm getting offline here. Any other questions before you get up and move? Yes. This is for my benefit.
There's a doctor that I read things from who promotes eating more salt to lower your blood pressure.
Eating more salt to lower your blood pressure.
And he says it works.
Well, how's it working out for him?
He is getting results apparently, because he's still
The reason I say that is because the data is totally against him. On the other hand, if a person is extremely low in sodium, that would probably be the only reason to balance out their electrolytes. And I meet very few people that have low sodium levels that are due to low salt intake. I meet people with low sodium levels because they got kidney disease. So I'm not sure how to answer you, Carol, but as a general rule, salt is hygroscopic. In other words, salt tends to be diluted with water. Therefore, if I put salt in the bloodstream, water is going to follow that, which tends to expand the volume. Therefore, I would expect more pressure. On the other hand, to be fair, about 25% of the people who are hypertensive are salt sensitive. In other words, you reduce the salt and you get an awesome decrease in their blood pressure. There are some people who you can decrease the salt intake and not get that same effect in blood pressure. But if you will combine salt to reduce the salt and reduce free fats like oils, you're going to get about 80% of the people in that group to lower their blood pressure and get them off medication. The next 20%, well, that's who I get to see in the office, I guess. It takes a little more work and a little more time. By the way, blood pressure is not a disease, it's a symptom, okay? Your real disease is endothelial dysfunction. That means the inside layer of your arteries are so inflamed they don't open or relax correctly, and therefore you have blood pressure problems. So that's one place where we in medicine could do a lot better. We call some symptoms diseases when in reality, if we don't deal with the cause, we're never going to solve the real problem. So. Folks, let's stand up. This is a clock, and you know, I think it's a hint to your pastor because they've made it so bright and so blue that you can't miss it. And it's all pointed forward, and you guys are looking forward, so I don't know what he did.
And but
he got a new clock up there.
I always ignore it. I never notice it's even there, so there you go.
When it starts flashing, you know.
When they turn the sound system off, I know it's time to stop. I'm going to give you the handouts that Dr. Collins has provided for us this evening. And also the yellow sheet on the front is a list of all the health type programs that we'll be having throughout the year. And the third one down, the depression recovery, there's 3 dates there. Those are the introductory. This is what the program is about. It's actually an 8-week program that is quite intensive and quite helpful for those that have taken it. But I'll be giving these to you, and just use them as you see fit. Ma'am? What's on here? Afraid I mixed it